everyone, Track Doc here. Today's talk is going to be about injury prevention. In recent years, doctors have found a marked increase in the number of overuse injuries in children from sports-related activity. Although the benefits of sports activity are significant, too much activity and overuse can lead to sports injuries. Because children are still growing, they're at a much greater risk of these injuries compared to adults. So what can parents and children do to help prevent these injuries? First is the pre-participation physical. The purpose of this physical exam is not to disqualify athletes, but rather to help identify conditions that may predispose them to injury and conditions that could be life-threatening. An injury being found that would stop participation occurs only about 2% of the time. However, it is important to identify these conditions to decide whether they require further evaluation, counseling, or rehabilitation. Number 2 is proper nutrition. Of course, this is a topic far too vast for this short video, and there is a great deal of information that can be found on the internet and information from your pediatrician. However, I will add a few tips. First and foremost, avoid sugar and sugar substitutes. It is much better to have a piece of fruit than a candy bar and to drink water rather than soda. I often get asked about the pre-participation meal. This meal should be high in carbohydrates and eaten 1 to 4 hours before your event. The closer you are to your event, the lower the number of calories you should intake. Also, athletes should avoid meals high in fat and fiber, as these can lead to gastrointestinal distress. Finally, young children should avoid caffeine, as this can predispose to dehydration. Number 3 is hydration. Often children and young athletes forget to hydrate. This is especially important in the hotter months of summer track. Dehydration can affect performance, cause dizziness, headaches, and in the worst case scenario, seizures and death from heat stroke. Children should be responsible for bringing water to all their practices and competitions. They should be encouraged to drink 4 to 8 ounces every 15 to 20 minutes while participating or practicing in the sun. Consider flavored water if this encourages intake, but again, avoid sugary drinks. Number 4 is proper warm-up. It is important for young athletes to perform a proper warm-up and stretching to help prevent muscular injuries. Unfortunately, there is a plethora of theories on what constitutes proper warm-up and stretching, and thus there's no consensus among coaches. Each has their own opinion based on their experiences and beliefs, and no two routines are identical. If you're interested in my routine, what I use in my athletes for proper warm-up, post a comment and I will reply. In addition, if there's enough interest, I will post a short video describing my routine. Number 5 is proper equipment. It is important for all athletes to have the proper equipment before participating in sports to prevent injury. In track, this is essentially running shoes. I recommend to all my athletes that they obtain their running shoes from a running specialty store. It is important to have someone who helps you, who understands athletes and their different foot types, running styles, their events, and understands shoe design. Also, athletes should keep a running log to track the mileage of their shoes and change them every 300 to 500 miles. Number 6 is avoid sports specialization. Please do not encourage your young athletes to play the same sport year-round. We have found in multiple studies a significantly higher incidence of overuse injuries in athletes who play the same sport year-round. Instead, encourage your children to play a different sport each season to prevent overusing the same muscle groups. Also consider taking a season off entirely for proper rest and recovery. Finally, don't play hurt. You do no one any good by playing injured. Take the proper rest, recover, and return to play when your pain has gone. More information on children and sports can be found at the website stopsportsinjuries.com. This is put out by the American Academy of Orthopedic Surgeons and in Sports Medicine and the Academy of Pediatrics. I hope you found this helpful. Stay tuned for my next installment, and happy running.